Welcome to the 354th Fighter Wing Digital Town Hall. I'm Nissen, and we are coming to you live from the Eielson Public Affairs Studio to discuss COVID-19, also known as coronavirus. To start off, we have a message from the 354th Fighter Wing Commander, Colonel Ben Bishop.
Team Eielson, I'm sure everyone has been following the news in regards to COVID-19, and I wanted to take the opportunity to provide guidance as the Wing Commander. First, please be aware that this is a rapidly evolving situation. Our leadership team is monitoring the situation closely and will continue to give guidance as we receive updates. For all those listening, please use your chain of command for any concerns you might have. You can also reach out to our public health team directly at 907-377-6678 with any questions or concerns. At the end of the day, we can contribute to stemming the spread of COVID-19 by washing our hands, being prudent travel plans, and taking care of each other. With that, I'd like to turn it over to our subject matter expert, Dr. Matt Ramage.
Good afternoon. My name is Dr. Matt Ramage. I'm the Chief of Aerospace Medicine here at Eielson Air Force Base, and I'm going to talk to you a little bit about the COVID-19 virus. No doubt you've probably heard about the COVID-19 global outbreak, and it's gotten a lot of attention, and there's a lot of media about there. So I'm going to take this opportunity to answer some questions and give you some information and some resources that you can go so that you know what to do to keep yourself and your family safe. A little bit of my background: I'm a family practice doctor by trade, and so frequently I'm getting lots of questions as this has been emerging for the past couple months with my patients. And so I'm going to take this time and just give you what we have there. Basically, coronaviruses are a family of viruses that have several occurrences during the normal cold and flu season. Coronavirus that we're looking at now is a novel strain, a new mutation that's new to our scientific knowledge. The good news is we know how this is transmitted. It's transmitted by what we call a droplet precaution. So when people are coughing, the viral particles will hitch a ride along the saliva droplets that will come out, and they'll gradually drift to the ground in a radius about 6 feet from where the person is sitting. This is opposed to other diseases such as measles, which has an airborne spread where the viral particles can sit and persist floating in the air for several hours. So we're lucky in that fact that the droplets are heavy and will sink to the ground. But that's going to lead to some issues because they'll also persist on surfaces there. The data that we have so far from the coronavirus, it can survive on surfaces for about 7 to 9 days and still be viable if somebody were to touch those surfaces and then touch what we call one of their mucosal surfaces like their mouth or their eyes. The data that we're seeing now as well, when people have gotten over the coronavirus, they're shedding the virus from the respiratory secretions for about 22 days. And there's a fecal spread of the virus for about 30 days afterwards. And so I'm going to highlight in a little bit about why it is so important to continue to wash your hands. Now in public health and epidemiology, we use some terms here. And one of those terms is incubation period. The incubation period is when somebody is exposed to a virus or exposed to an infectious agent. That's the period of time from exposure until they first have symptoms. In COVID-19, we've seen a range of about 1 to 14 days, but the average incubation period is about 5 to 6 days. That incubation period of 14 days is critical in defining what the quarantine period is. So for those who are exposed to areas of high risk and then return to areas where it is not present, it is key that folks will will separate themselves from others for that 14-day period. Now, just because you're quarantined, it doesn't mean that you're sick. It doesn't mean that you're going to become sick, but that's a watching period just to make sure that you're not at risk of spreading the virus to other people.
So Doc, I just want to take a minute to remind people that this is a live town hall being run digitally through Facebook. So if you have questions, absolutely throw those questions in the comments if you're listening right now. We're going to get to them once we take a break and make sure that we're tracking all of them. But here's a burning question I have, Doc. You're talking about incubation period, and you're talking about all this and isolation versus quarantine. Can you just explain the difference there, just so that people kind of understand? Like, I think of quarantine, and that to me means like a guy has locked me in a room and he's following me around in a hazmat suit and like checking my temperature every 10 minutes. So I guess I know you have a different picture of what that looks like.
And that's a great question, because a lot of things that we see from the media and look at in movies, people can get some interesting conceptions about what isolation and quarantine is. So in the overall umbrella of something we call restriction of movement, there are two basic flavors of that. Number one is quarantine. Like I talked about before, if you were exposed to a virus, or in this case, if you're exposed to COVID-19 by somebody who has been diagnosed formally and you're around them, or you're coming from an area where there's high community spread of COVID-19. So once you have that exposure, we recommend quarantine, and we meaning the CDC and most competent medical authorities recommend quarantining, where you put yourself where you're separated from others by about that 6-foot radius, and ideally in an area where you can keep others away from you. So in a wing of your house, in a room, so that you can have access to one bathroom, your bed, and any of the food that you would need. For the purposes of COVID-19, that period is 14 days, but depending on other agents, that time can expand or contract. But for COVID-19, the quarantine period that is recommended is 14 days. Now, your question about isolation, that's where you have somebody who is having symptoms and has had the diagnosis or is pending official diagnosis of COVID-19. We're recommending those folks sequester themselves away to limit the spread to others. Because you're having somebody who is actively symptomatic, they're coughing, they're potentially spreading the virus, and we want them to get better but away from others so that it's not transmitted to others. Okay, did that answer your question?
That absolutely answered my question. So Doc, I think I definitely see some questions coming in. We're going to take a quick break just to review them, and we'll get a message from our sponsors as well. And we're back with a message from our sponsor. Today's live digital town hall is brought to you by Clean Hands. Did you know that clean hands are free and can be obtained through the 5 simple steps of hand washing? These 5 steps are wet, lather, scrub, rinse, and dry. You can help yourself and your loved ones stay healthy by washing your hands often, especially during these key times when you're likely to get and spread germs. So that would be before, during, and after preparing food, before eating food, before and after caring for someone who is sick at home, before and after treating a cut or wound, before and after using a toilet, before and after blowing your nose, coughing, or sneezing, and after touching an animal, animal feed, or animal waste. So thanks to a message from our sponsor, Clean Hands, we'll be back to the show now. So, Doc, we got a few questions. I think one of the burning ones was on symptoms. So can you inform us a little bit about what these symptoms, like what are people actually looking for here?
Absolutely, Kay. So as I stated before, coronavirus is a family of these common cold viruses, but this individual strain is being a little bit of a booger for us. These overall symptoms that you would expect from coronavirus are very similar to what you would have with your run-of-the-mill cold or flu. But looking at the retrospective data from China, 3 big things stick out. Fever, shortness of breath, and cough, because this is a primary lower respiratory tract illness. Now, fever is an interesting thing. A lot of patients will talk about this low-grade fever, this and that, but I just want to take this time to define exactly what a fever is. So a fever is a temperature 100.4 degrees Fahrenheit or higher. Anything less than that is not a fever. So if you have a temperature of 100.4 degrees or higher, you have a fever. Additionally, if you don't have a thermometer to measure, the CDC from its perspective is also looking at something we call subjective fevers. So if you've ever had a cold and have been sitting there just feeling hot and sweating, take that as a sign that you probably have a fever. Measure your temperature if you happen to have a thermometer, but know that it is not specifically necessary. An interesting thing that we saw from the Chinese data, so from about upwards of 4,000 patients, there was one symptom that was notably absent from patients with coronavirus diagnosed, and that's a runny, stuffy nose and nasal congestion.
Something you'd see in like a common cold, really.
Absolutely. Now, I want to be clear that while it is reassuring if you have nasal congestion that you probably don't have coronavirus, please do not use this as complete reassurance that you shouldn't take other necessary public health measures. So fever, shortness of breath, difficulty breathing. We're talking you're having a hard time catching your breath, having to really work hard. Your breath rate is increasing. And cough. Cough, anytime that you have inflammation of your lungs, that's your body's response to try to get that mucus out of there. And so that cough can persist for weeks and weeks.
Interesting. That was a question from Karen West. Thanks, Karen, for sending that our way. One of the other questions I saw, since we are here in Alaska, it was, have there actually been any cases here in Alaska of coronavirus?
Great question. So, knock on wood, as of this moment, there have been no diagnosed cases of coronavirus in Alaska. However, we live in a global economy. There's frequent travels. We're on a military base, and there's lots of travels in and out from various parts of the world. Spring break is going on right now, and we'll have people coming back. So just because there currently is no diagnosed case in the state of Alaska, if I had to bet, I would say that might not be the case for too many weeks longer. And so while it's reassuring, we should always prepare of what we're going to do when we finally see these cases come into our state.
Awesome. Well, hey, Doc, I am seeing a lot of questions about travel, but I want to take this moment just to take a break so that we actually get ready to answer all those questions. So in our next segment, when we come back, we're going to do something called a scenario segment, which is where we're really going to go through all these questions about everyone's individual situations and what that actually means. So I hope you're ready for that, Doc.
Absolutely.
We'll take a break here and catch up on your questions. Keep them coming. Welcome back to Eielson Air Force Base live digital town hall on coronavirus. I'm here with Doc Ramage, and we're answering your questions. So before we get into our scenario segment, because we see lots of individual scenarios that are playing out about people needing advice, we will get to that in just a second. First, we wanted to go over vulnerable populations, because this is really just an education piece for us, right, Doc? So can you tell us a little bit more about who is actually affected by this virus?
Absolutely. So like we've seen in the news, there are lots of cases. As of this morning, there was approximately 125,000 diagnosed cases worldwide. Now, again, that's diagnosed cases because we do have limitations on the amount of testing kits. Right now, we're looking at about 4,600 global deaths attributed directly to COVID-19. Now, to put some perspective on that, in the United States, we're looking at about 1,300 cases with 30 deaths attributable to COVID-19. The global, what we call fatality rate, so the people who get the disease and then go on to unfortunately pass away from the disease, is now about 3.4%, which sounds very scary. But I do want to put a little statistical caveat in there. We don't necessarily have the full appreciation of how many cases are actually out there. And so in the United States, there is something that we would call a testing bias. Typically, those people that are having the more severe symptoms, which would be more likely to go on and have an unfortunate outcome, are going to be the ones who are more likely getting tested. So like I said, the current fatality rate worldwide is looking about 3.4%, but with population density averages, the case fatality rate is probably closer to 0.5 to 1%. That is speculative. Now, you mentioned vulnerable populations. Who should worry? So, of course, we're all generally worried because we don't want to get sick with this. But let's look at the numbers that we're seeing from China. About 80% of the folks that were diagnosed with COVID-19 actually only had mild to moderate symptoms. So 8 out of 10 people who got COVID-19 were able to go home, sleep it off, have some ginger ale and chicken soup, and be just fine. Now, I will recommend that folks that are diagnosed with COVID-19 listen to your healthcare provider and the appropriate time that it would be to return to work. Now, here's where we get into the scarier news. There's a group of our population out there that is a higher risk of having long-term disability from COVID-19 or death. So let's break it down by age groups. For those individuals 80 years old or higher, the current data suggests that about 15% of those individuals are dying. And so I want to foot stomp that. If you are sick, if you're traveling through an area that has COVID-19 that is widely spread, please, as much as practical, distance yourselves from your elderly relatives and don't be scared of it, but you want to give them the best opportunity to not become affected. So 80 years and plus, we're looking at about 15% mortality. That drops by half from the decade of the 70s. Folks in their 70s, only 8%, so half the mortality rate. And even lower, 60 to 69, we're looking at only a 3 to 4% mortality. Here's the great news. Our population, less than 50, is less than 1% fatality rate. And the better news, because I know there's a lot of parents out there with young children, so far with this virus, we haven't seen the devastating effects with the very young population. So kids seem to be doing okay with this. Now, please, continue to exercise your public health precautions and normal hand hygiene that we'll discuss in a little bit. But from an age risk perspective, if you're in your decades of 70s to 80s, that's where we're having our highest risk. Now, let's talk about people with pre-existing conditions. And again, this data is from people of all age groups with these specific conditions. If you have high blood pressure, and granted, most of our patients with high blood pressure are also going to be in that upper age bracket, but the data suggests that 6% of individuals with high blood pressure who have COVID-19 are having unfortunate outcome of death. People with lung disease, so if you have asthma, if you have other lung diseases, take special precautions to not expose yourself unnecessarily. Folks with atherosclerotic coronary vascular disease, so the heart disease, about 10% of those are having mortality or death with COVID-19. Does that answer your question, Kay?
Yeah, absolutely. So thanks, Doc. I know vulnerable populations, right? I think we've been watching the news. We're kind of getting that message, but it certainly helps. If you're listening right now, please help us educate others who need to hear that. I would be especially concerned for any elderly population. So
Absolutely.
Great. So we're going to move into our scenario segment, pulling some scenario situations from the actual comments here. So one was, and this is just where we're going to ask the doc just some advice, right? Really just basic advice based on where we are right now. Caveat being things can change, so we are today giving you advice. All right. So here's a scenario. I have to travel to Indiana where there are confirmed cases of COVID-19. Am I safe to travel? And mentions that she's traveling next week.
Okay. That's a great question. So I want to really encourage everybody who's listening, before you travel, before you make any plans, frequently check cdc.gov. That's Centers for Disease Control. So cdc.gov. There is lots of wonderful information about travel and about destinations. Now, to the question here of traveling to Indiana, right now, Indiana is not one of the high-density local spread environments of COVID-19. When you travel, it is not a no-risk situation, but it should be a lower-risk situation. But again, if you've ever traveled before, gone on vacation, and came back without getting sick, as long as you do those things, you should be okay. Be mindful not to touch your face unless you've washed your hands, and then wash your hands afterwards. Be mindful to wash your hands after you're touching the public surfaces in the airport. After you go to the bathroom, and be mindful that when you're around other folks, if they're coughing, keep your distance. And if you're coughing, make sure you cover your mouth with the crook of your arm so that you can limit the spread of the respiratory droplets. The big issue here is, yes, there is COVID-19 out there floating in little pockets around our nation and other nations in the world, but you're still at a higher risk at the moment of getting the normal cold viruses, normal flu. And so by preventing getting those, it's going to limit the confusion and consternation that you're going to have later when you're worried about you're sick. Do you have COVID? And by all means, while we don't have a vaccination for COVID-19, there's one deadly virus out there that we do have a vaccination for: influenza. I know a lot of people out there aren't necessarily happy to get their flu vaccine every year, but truly, get your flu vaccine so we can at least limit the spread of that, and so it can debulk the amount of cases that are presenting to our healthcare facilities, so that they can have those resources to take care of folks as we potentially might see the rise in COVID-19 cases.
Awesome. Well, yeah, that was a question from Ashley Edwards. I will note that I misspoke. She was saying specifically layover areas that have been affected. But I think your advice still applies, Doc, where as long as you're being super cautious when you're in the airport, washing your hands, keeping a little distance from people, you're going to be okay. So thanks for answering that.
Well, absolutely. These layover airports, especially sensitive to me being in Alaska, because 99% of the flights that come in and out of Alaska that I'm going to be on are going to go through Seattle. And of course, in the news, there is the recent spike of community transmission north of Seattle. So yes, the airports are a general melting pot of the world, but also they have a character from an epidemiologic standpoint of the community which they reside.
Can you say that in layman's terms?
Yeah, I love it.
Sorry.
So just because you're flying through Seattle doesn't mean you're necessarily absolutely going to come in contact with somebody with COVID-19. But yes, still exercise the same precautions. Don't touch your face. Don't unnecessarily touch public surfaces. Wash your hands frequently with soap and water. When not available, use hand sanitizer. And don't lick doorknobs.
Sounds good. So another comment I saw on there looks like a mom of one of our airmen. Thanks, Mom, for tuning in. She said she's traveling from Pittsburgh to see her daughter here at Eielson over spring break. So she was kind of asking that same question. Still recommend to fly. I will note I think it was over Easter. Over Easter. So a little bit, few weeks down the road.
Okay.
What are you thinking there, Doc?
So the situation is still emerging, and again, right now with the information that we have, it's still considered safe to fly. However, as long as you don't fall into one of these higher age groups and have any of those medical conditions, lung disease, cancer, or heart disease, you should be at a normal risk as long as you're doing the good practice hand hygiene precautions. And be sure and bring cookies. I'm sure she'll like those.
Perfect. All right, I got a few more scenarios. These are ones that I kind of ginned up on my own. So one or two might be relating to me. I'm an active duty member, and me and my family are planning to go to Hawaii this month. Has Hawaii been hit on the CDC travel list? And what should we be worried about when traveling with young children?
Great question. So I want to clarify that the CDC travel list, it talks about nations other than the United States as far as travel risk.
Okay, so not state by state.
Correct. And so I recommend that if you're looking at travel within the United States, go on and do a search for that individual state's public health department, and they will give you all the information, hopefully give you all the information that you would need. Right now, from my last information that I've gotten about Hawaii, yes, there are some cases in Hawaii, but it is not a wider spread. And back to, of course, you're flying through Seattle, just continue not to touch every surface in there and wash your hands before you eat those pretzels on the plane.
Yeah, perfect. So next scenario, I'm PCSing to Eielson from the Republic of Korea.
Okay.
Maybe from the Wolf Pack, right? In a few months, what should I expect will happen when I arrive on base?
Very great question. We have a myriad of folks that are coming TDY and PCSing to Eielson from the Korean Peninsula. At the moment, as I'm sure that you're aware on the news, Korea has a very wide public spread of COVID-19, both on and off the bases. For individuals coming from the Republic of Korea, we are recommending, and this is in line with CDC guidance, once you get out of Korea, there's a 14-day self-quarantine period. Now, let me clarify that a little bit. In order, from the active duty member's perspective, in order to start duty and interact with the rest of the base population, there will be a recommendation from your commander to quarantine yourself, where you will be in your house or in your lodging, and food and necessary supplies will need to be brought to you, and you'll be there for 14 days. We are actively getting the names of members who are inbound from these locations and giving those to public health. So public health should be reaching out to you once they get your name in order to monitor you and give you any information, any answer to any questions that you may have, as well as be a point of contact if you start to have symptoms. Because the CDC testing criteria is if you are coming from a nation with a high risk of transmission, or you have exposure to somebody with known COVID-19 and you are having symptoms, the fever, the shortness of breath, the cough, then you meet the testing criteria so that we could use one of the very limited supply of testing kits that are out there. The number is increasing by the week, but we're trying to triage to make sure that we're using these testing kits with the best effect rather than potentially testing everybody out there who might just have a normal cold. After that 14-day period of self-quarantine, as long as you've not had symptoms, you are free to
Freedom.
move around.
Yeah.
Free to go.
Got it. Okay. So So I guess what the real thing here is that, like, even if you're coming from Korea, I think for the base populace, right, we are going to potentially get some people coming in who are PCSing. It doesn't necessarily mean that they have the virus, right?
Absolutely.
So I think that's just foot stomp. But precautions of 14-day, hanging out, not really interacting with other people. So
absolutely.
Okay.
And let me reiterate something there. So if you are traveling from a high-risk location and for some reason you haven't been told to go into a restriction of movement, that self-quarantine, and you come down with symptoms, I understand it would be very tempting to just go straight to the medical group, straight to a clinic. What I would recommend, though, if you're coming from these high-risk areas, and you'll know these because you're looking at cdc.gov.
Exactly, yes.
You will, it is highly recommended that you call our public health office. And the number for public health is area code 907-377-6678. That's 907-377-6678. That's Eielson's Public Health, and they can get some information from you and arrange a time so that when you get to the clinic, you will be received, and we can keep you separated from the other non-ill patients in the hospital so that we can limit the spread. Because remember, we also do have that vulnerable population getting seen for their clinic appointment visits as well.
Got it. I think we're going to go one more scenario and then we'll take a break. So last scenario here, I'm on Eielson Air Force Base right now. And this is a fictional scenario, folks. And I think I have those symptoms. I have a fever and coughing, but I have not traveled outside the state in the recent past. What should I do?
Great question. So I'm going to break this scenario up into two bits. So right now, of course, we do not have any diagnosed cases of COVID-19 in the state of Alaska. And so there are, I at least see 20 people a day with what we call upper respiratory illnesses, the normal cold. And so you should, if at all possible, stay home. Don't go to work. Your supervisor can give you 24 hours quarters without you even having to come to the medical group. But because COVID-19 is a little bit of a concern, feel free to come into sick call at the moment, because we don't have any diagnosed cases in the state yet. Feel free to come into sick call and you'll be seen. As the situation emerges a little bit and we start to have the COVID-19 cases in Alaska, I am going to recommend that folks with these upper respiratory symptoms, that cough, that fever, even without travel, to call the appointment line and get direction. That number at the clinic is 907-377-1847. So that's the appointment line that you can call, leave a message for your provider. If you mention that you have these concerns, they will get a brief travel history to see if you meet the criteria of high-risk exposure or not, and then you will be given the symptomatic treatment or testing that is indicated at that time.
Okay. Sounds simple enough, Doc. Thanks for the numbers, and I'm sure we'll get those posted on our comments page as well. We see that there's lots of questions coming in. We're going to take a quick break and make sure we get caught up. So keep tuning in, and thank you. And we're back. Thank you everyone for tuning in. It looks like we've got lots of comments and questions, and a lot of people helping each other out with pointing them to good info. So please, if you're listening and you're getting a lot of good stuff, please make sure you pass on this information. And thanks for tuning in. So some of the questions that we got that we want to address right away, Doc. This one's from Cindy Mayer Moody. If OAAC clinic is active duty only, I don't know what OAAC is or what that means, but
so here at Eielson in the flight medicine clinic, we have the OAK clinic, the Operational Acute Care Clinic. It's an ability for active duty members to get rapidly seen and either sent back to duty or home. Now, right now, so the OAK clinic, yes, that is an active duty only. However, as the COVID-19 situation changes and evolves here in Alaska and affects our local base and our ability to see patients, there is a threshold in which we would have a respiratory illness clinic. So anybody who has any respiratory illnesses, so cold, fever, cough, shortness of breath, they will be seen in a segregated area of the medical group so that we will, number one, confine those patients in an area separate from those higher vulnerability populations, and number two, there will be a limited group of doctors, myself included, who will be seeing these patients, and so we will hopefully limit the transmissibility to the other physicians who are seeing the regular primary care clinic. So yes, right now OAK Clinic is active duty only, but stay tuned, and at which point we go to a respiratory illness clinic, we will let you know, and we'll have signage and guides at the front of the med group to let you know what to do.
If I'm reading through the lines here, I'm assuming if it's the OAK clinic you can go to for active duty. If you're a dependent, what do you do then if you want to kind of call in your symptoms?
Great question. If you have any symptoms, call and make the appointment with the appointment line, 907-377-1847.
Got it. So go through regular appointment line if you're a dependent and you have those symptoms.
That is correct.
Cool. Another question that we got is from David Dirth. I do like this question because I don't think I would have thought of this myself. He had mentioned that the fecal spread, right, for this particular virus, and he was asking if we should just be avoiding public bathrooms in general.
Well, and that all depends on how you use that public bathroom.
Okay.
So yes, public bathrooms inherently are not something I want to go eat some filet mignon on the seat. However, feel free to utilize the public bathroom, but do normal hygiene precautions. And so after you finish, and guys, I'm talking to you, even though you may just urinate, wash your hands, because just normal bacterial spread is probably the higher risk that you're going to get. And then if you happen to be symptomatic, spreading it to others or having others. Now, when you wash your hands, I want you to wash your hands like you've just changed the oil in your car and your grandma needs you to help her fold her mama's favorite quilt. That's the level of hand washing we're talking about here.
How long does one wash their hands for?
Well, the CDC recommends 20 seconds of hand washing with lather and water.
Okay, 20 seconds. I believe that is Happy Birthday sung extremely slowly. 20 seconds. Twice. Oh, twice. Sing it twice, slowly. And that is how long you should be washing your hands. Cool. Well, thanks, David, for that question there. Looks like Chaplain Harp is tuning in. Hey Chaplain Harp. He had great questions about large gatherings, particularly for church, but also for things like movie theater. What are you recommending to us there?
Absolutely. So it's a brave new world. We are increasingly gathering in large groups to socialize, which is very important, especially now that breakup's happening. Get out there. But this is where I want folks tuning in to be aware. We have something called force health protection conditions. So currently we're at HPCon Alpha, means that, hey, COVID-19 is a thing. We're watching, we're monitoring the situation. But as we start to elevate into Bravo, meaning there's COVID-19 in Alaska, things are going to be a little more prescriptive about what we're doing. General guidance, yes, as much as practical at the moment while we're trying to figure out COVID-19, I would avoid large gatherings. However, as long as you're covering your cough, as long as you're not touching when you're greeting folks, do the elbows, do the wave, do the Vulcan live long and prosper sign if you want to. But just limit the amount of transfer that you're having with other folks. But there's no reason why you should necessarily be scared of large public gatherings, but just be smart while you're there. Now, if there's an elevation in the base health protection condition, these restrictions on large public gatherings will be made known.
Got it. So we'll get that update when it's time to be concerned about large gatherings.
Absolutely.
Okay. Got it. Well, thanks for the question, Chaplain Harp. I think we're actually going to take a quick break. We know we're coming up to the end of the hour. I want to thank you guys again for tuning in and for throwing questions. What we're going to do in our last segment is kind of go through immediate actions to take, right? So the things you should be doing right now, and then we'll close it out and see if there's any more burning questions we need to answer. So thanks again. We'll take a break really quick. All right, welcome back. This is going to be our last segment of this live digital town hall here at the 354th Fighter Wing. I want to say thanks again for everyone who's been listening. There's been a lot of great questions. The doc's been answering a lot of great questions. But our last segment here, we wanted to make sure that everybody knew what we should be doing right now. So two questions that we saw in there were from Ben Hartline and Kayla Mayhew. They were asking about shipments. They were asking about supply, right? We live in Alaska, and it's kind of a concern for us. I don't know that we can talk specifically about logistics here, as our doctor is a doctor, but we can talk about the things you can control right now. So, Doc, what should I be doing? I'm here in Eielson. I'm going to be here in Eielson. I got a family. Obviously, I'm gonna listen to all the hand washing stuff, but is there anything else that I should be doing right now?
A great question. So I've always wanted to say this. I'm a doctor, not a logistician. Anyway, so let me tell you what I would do when I get my Amazon package. Then we can go about what we do with which kind of the normal precautions. So yes, I get my Amazon packages just like everybody else. You open it up, you recycle the box if you can, and you wash your hands. So really beyond that, just normal practical measures. I wouldn't specifically worry. If somebody on the other end of the supply chain had COVID and decided to cough all over that, it's probably all over a lot of stuff anyway. So just wash your hands and do what you can. But more to the question, what can we do right now? So the foot stomping issue, all of these measures that we're doing are going to limit the sharp rise in cases as much as possible so that we're not going to overwhelm the hospital infrastructure. Wash your hands. Wash your hands before you eat. Wash your hands after you touch yourself. Wash your hands after you go to the bathroom. Wash your hands after you touch any public surfaces. When you show up at work, I am advocating this wipe in, wipe out campaign at duty sections. When you get to your duty section, wipe it down with an antibacterial solution, which there is a list out there on the CDC of the EPA approved antibacterials that do clean COVID. Right now, the Clorox wipes, the Lysol wipes, or if you're like me and like to save money, a 1 part bleach solution, 50 parts water in a spray bottle equals a 0.1% hypochlorite solution, which is effective against coronavirus. So wipe down your work section, wash your hands frequently throughout the day, and then wipe it down before you leave. It is a prudent operation to think if you you work in an office environment, have an adopt a highway approach to the doors around the office. Have somebody whose job to take care of these 3 or 4 doors. Wipe down those door handles. Wipe down the public use service counters at places. Light switches, of course. Any of those high touch items need to be cleaned off because the COVID-19 will persist on the surfaces. Now, unless you've been sleeping for the past couple weeks, toilet paper is a big deal for a lot of folks. Make sure that you have your house stocked responsibly. And so if you can have enough things in your house to take care of your basic necessities for a 2-week quarantine period, you are adequately prepared. Do not go and panic buy. We need to make sure that the supply chain is available for other people to get the items that they would need. Otherwise, we're now stressing a supply chain that is already, as mentioned by those few questions that we just had, already strained with areas decreasing their shipments. So buy responsibly. We're all in this together.
Yeah, that sounds great, Doc. So I'm translating what that means for me. So as long as I kind of already have some Lysol or Clorox wipes in my house that I know would last me 2 weeks, I'm good to go.
Good to go.
Okay.
Don't forget the hand sanitizer.
Hand sanitizer.
And soap and water.
Soap. Got it. I believe we have all those things, so I'm feeling pretty confident. And yeah, in my workstation, I will certainly encourage my airmen and my fellow coworkers to wash their hands a little more.
Now, for those folks out there that do take regular medications, make sure that you have at least a month of medications on hand. God forbid if you should get ill and be isolated or have a situation where you're quarantined in your house, you will have the medications to keep you otherwise healthy.
Awesome. Cool. So sounds like some proactive planning will keep us pretty good here. I guess we're standing by if there's any changes in guidance. But as of now, guys, it seems like hand washing is the theme of the day and will be the theme for some days to come. So with that, we are at the 1 o'clock hour. I want to say thank you to everyone who tuned in. We're going to continue to answer questions via comment, but we are going to let Doctor get back to doing what he does best and head back to the clinic. And thanks again. This is the 354th Fighter Wing Public Affairs Digital Town Hall on coronavirus. Have a wonderful Thursday.